First, let me just say thank you so much for having us here. We know that oftentimes it's not easy to get some of the policymakers out of our offices in Harrisburg to come out to meet with you. But I really did want to come out and be able to share this with you. I can tell you, just in sitting and listening to the presentations that were made this morning, I was personally in awe. Just in looking at the research, you know, hearing some of the things that you all have identified as being very important to children, but our families overall. You know, the things that they go through, the things that will impact their development, those things are important. They are important for me personally, I would say. Just on a personal level, as I was listening to Ms. Gregg speak, I was thinking, wow, that's much like my own personal life. You know, most people don't realize I was probably one of the people that she spoke about just in growing up in an environment where things weren't so great, where you weren't necessarily thinking that you would get out and you would have the opportunities that I have been afforded. So I look at all of you and I say thank you for providing that type of research, because I think it is very much needed. I think there are people that need to know what it is that you're doing and what it is that you're finding, so that folks like myself and the other women up here can help to make some of the changes and prepare our families for the future. You know, when I was thinking about what I would talk about from just an agency perspective, I work for the Department of Human Services, the Pennsylvania Department of Human Services. Oftentimes, we don't have a lot of time to sit around and to do the research that you all do. We really do rely on researchers. You know, we don't say and walk around and say, I am a researcher. That is not what I am. You know, I rely on folks like you, and that's what we do as an agency in large part. We're looking for those types of papers that we can get from you so that we can come to the table and have those types of discussions. And at DHS, when I think about how we will be able to move on some of the things that you've talked about, I would say for us, at least over the last 6 months or 8 months at this point, we started to do some of that in some of the areas, particularly as it relates to the CHIP program. You know, one of the ways in which we had to look at some of the policies and things that we wanted to implement, some of the things that would make sense, not just for the kids, but for our families, and more of a holistic approach, was to look at how could we make that happen when we have some of our programs that are existing in 2 different state agencies. Some of the information. Okay. Is that better? Okay. So some of the things we were thinking about is, you know, we have these programs that we think lend itself to some of the research that you're doing. We think there are ways that we can improve them. However, we have to look internally within our organization, meaning the Commonwealth at large, to figure out first, how do we get them to the right place? Because many of you may or may not know, but the Commonwealth is huge when we think about state government. I'm sure when you've tried to reach out to us at different times, you didn't even know where to start. In many instances, we hear, well, we don't even know what department to go to. We don't even know what office handles this or manages this. So even in this particular instance, we had to figure out, okay, we have a great program that we currently have that's dealing with children, that's providing them with health insurance, that's providing them with free coverage, no less, but is currently sitting in our insurance department. And while in certain ways that may make sense, our Department of Insurance, they really do, you know, the regulation of the private insurances and things of that nature. When we looked at CHIP, we wanted to say, well, it's not just children, because as we said, you know, we have to involve the families, the parents. So we need to look at what else would be available to help that child that would be in this program. So as we begin to do that type of internal analysis within the state, there were discussions that ensued, you know, amongst the governor, amongst the insurance commissioner, amongst our secretary, to talk about moving this program out of the insurance department into the Department of Human Services, thinking that human services really encompasses all of the different aspects that we talked about. That would get us closer to providing maybe some of the things, some of the solutions, some of the answers to some of the challenges that have been raised. So that actually happened back in December of 2015. The law was actually passed and signed for the CHIP program to move out from under the Department of Insurance into the Department of Human Services. So since that time, we've been going through kind of that transition and looking at how now we can access all those things that sit within human services and how we can actually strengthen our program. So one of the great things about it is now that we're sitting in human services, we have access to our Office of Children Development and Early Learning, right? We have access to mental health and substance abuse, the Office of Children, Youth, and Families. We also sit side by side with the Office of Income Maintenance, which determines the eligibility and works with the MA side. So now we're at the table. We feel like we're more appropriately situated. Now it took some time because obviously when you have to work through legislation and you have to get all of the stakeholders on board, including individuals like yourself, to understand that we're not trying to do harm to a program, but we're actually trying to increase the benefits of a program and to capitalize off of opportunities that we believe already exist within the state, even if it is just at another state agency. So as we did that, and we're now moving through, we're in month 10 almost now, October, that transition is still going on to figure out, now that we're here, let's make sure we're at the table with all of our colleagues in all of these other offices. So one of the things, for instance, I'll tell you that we've begun to do is we meet regularly just as a core team to talk about what is impacting all of the offices. So when I look at the children that we serve, in CHIP we serve individuals from the time they're kids all the way up through teens up to the age of 19. So any of those individuals that do not have insurance, that are not covered under medical assistance or any other insurance, those would be the individuals that we serve. So we look at all of the things that they're dealing with from a health insurance perspective. Obviously, we want to make sure the coverage is there that would include some of those developmental things that you all are finding are important, some of the things that your research is telling us that we need to be aware of because it has those long-lasting impacts on the children. So we're looking at those things in concert with some of our other program offices to say, okay, well, it's not just us because we have a piece of it, but let's look at it again more holistically. Let's look at what you're doing from an education perspective with the same population. What are some of the things you're doing to make sure that we're not missing opportunities when it comes to educating them while we're doing the health insurance and providing those funding resources that they need to get that type of coverage. We're also working with our Office of Medical and Health and Substance Abuse program to make sure for any of those kids to have those behavioral health issues. We're not leaving that aside either. We want to make sure that that would be incorporated and inclusive so that we would have them around the table as we're having those discussions as well. So we're really trying to figure out how to build this coalition, if you will, within our department to make sure we have the right folks at the table to talk about some of these policy things that go beyond what any one of our programs would essentially be addressing. One of the things that we've started to look at, I know there's a representative in here from the Pennsylvania Partnership. We have received a paper from them on developmental screenings. We have actually read that paper. It goes into detail about some of the things that we think as a state we could do better at, or to at least look at to figure out what kind of tools we can do to make sure it's occurring. So we've already pulled together a cross-agency team. It came in kind of through one door, and we've already said, well, hey, this is not something that we can just take within a CHIP program and look at it. So we've already pulled folks from all of those offices that I've mentioned to actually sit around the table to start looking at, well, what does that mean? When we start talking about development and screenings, what are some of the things that we need to do? We've already started to canvass some of our providers to find out what they are actually doing, to look at some of the statistics, to figure out what the stats are showing us. We're going to use some of that data to help us inform what we need to do from a policy perspective to increase those numbers, to see, okay, where do we really stand? First, we have to identify that baseline, though, which is what we're working on now. But that's an example of how we're really trying to pull this information in as we move forward and to figure out how we can collectively, as an organization, look at what's going on and really capitalize off of all of the opportunities that would exist in any one of our offices, not just within the CHIP program. So the other thing that we're doing, and we try to do this about every 5 weeks or so, we come together collaboratively to look at all of the data. So again, I said we're not researchers, but obviously the state holds a ton of data. We get lots of data all over the Commonwealth for different services that are available, for different things that are occurring in every county. So what we've done, and we've been doing this for a while, but we're doing it a little differently now, we have what we call these people stat meetings. These people stat meetings in the past have been situated based on each program office, and it was an opportunity for you to look to see how your office is doing. Well, we said, well, hey, it's not so much about the office, it's really about the service delivery and what we're actually providing to our families, to our members, to our kids. That's really how we want to have that focus. So that focus shifted, and now we actually have those same meetings, but they are situated based on a particular subject matter. So we have customer service, we have increased access, we have quality. We're looking at those things that we believe that really matter. It's not just about whether you're in, our Office of Children Development and Early Program. That's great, but you're going to be at the table if you have any piece of any of those subject matters. So we're now sitting around the table talking and looking at the data to look at the statistics to see what are they telling us, and then making plans to figure out, well, what does that mean? What are some of the changes that we actually need to make from a policy perspective, and how do we go about doing it? Again, one of the things with the government we recognize is, we don't always operate very quickly. We know that it takes us a moment or two to get our ducks in a row before we can act, but I can tell you we are getting much better at aligning everything so that we can make that process easier, because we do believe if we don't start right in the beginning, we certainly won't finish the way we need to finish. So we are really taking a hard look at how we can continue to have that type of dialogue around the table with everyone, not just keeping it isolated in different silos. And I think that has been really the first step for us to really begin to implement some of the things that we're starting to hear. I think, since being at CHIP, we've started to receive lots of information about things that we should consider, things that we should look at for the kids. We had an advisory council meeting just this week, and we had a presenter, Dr. DeChimo, that's from this area, that came out to talk to us about embedded behavioral health. Well, the presentation was phenomenal, to just talk to us about what you all are doing out here, and to look at that, to begin to see how else can we utilize that type of model, around the state, whether it's something that can be incorporated within CHIP, but also just in general within the services that we provided elsewhere, because right now it's primarily helping it out this end, not so much in the southeastern part of the state. So things like that, we invite you guys to come to us to give us this type of information so that we can be aware of it, because oftentimes we don't know everything that's out there, although we obviously look to our own data to tell us what's working, what we believe is working, but obviously some of our people on the ground floor have a better understanding and can tell us what they see on a day-to-day basis. So again, for us, it's mostly just been focusing on those systematic change to line us up so that we can have the right players at the table to be able to implement and make some of the policy decisions. I can see that that is actually starting to happen in a different way now. Not that it hasn't happened in the past, but I think it's happening differently now, and I think because of that, we'll be able to see some change a little bit faster maybe than what we've seen in the past. And I do encourage you, to make sure that you are sending your information in. We do actually look at it, even though we can't act on everything, because of course that's when some of what I know some of you refer to as bureaucracy comes into play at times, when we have to go through some of the things that we have to go through, some of the channels that we have to take. But it doesn't mean that we aren't looking at what you presented and truly taking that in to figure out how we can provide some sort of service, how we can fix something, or how we can provide an answer or a solution for what it is that you're finding. So that is what we've been doing at the state, and that's what we'll continue to do. I will say, for any of you that's not as familiar with the CHIP program, I don't know how many of you know about the CHIP program. It is a fantastic program. I would encourage you to check out our website if you have not already done so, just to learn more about what we do and how we provide it to the children in the Commonwealth. Many advocates and partners around the table, some in this room, help us to make that a great program, and we are hopeful that it will continue to move in that direction now that we sit at DHS and can incorporate some of those office policies into what it is that we're doing.
Let's thank Lisa.